Hi, I'm Dr. Jamison Spencer with Cadwell Therapeutics. I'm going to show you how to modify the silent sleep tray in case the patient has mandibular tori. So anytime before you fit the silent sleep, you should take a look in the patient's mouth to make sure that they don't have mandibular tori or other areas where the appliance may lock in, such as a long span bridge or something like that. Now with tori, the reason that we want to check for that is it could be uncomfortable for the silent sleep tray to rest on their tori. So if Jenny did have tori open and we put that in her mouth with the material in and she closes down, it could push the inferior border of the tray right against her tori. Now this is not a sharp material or a hard material, so it would not be that uncomfortable, but nevertheless that pressure being put on the tori when she's wearing the appliance would make it uncomfortable to do so. So what we want to do is prepare the tray once we see those tori. So I'm going to use some utility wax, some white rope wax. You could use red rope wax, won't matter. And basically just put this on the tray. This is also a nice technique if you would like to put a spacer on the lingual bar. Try to do that too. You just push that against the lingual bar. If you have somebody that perhaps they've got kind of crooked lower teeth or something, and you just want to make darn sure that that lingual bar does not touch their teeth, then we can put a spacer there so that once it's fit, we can remove the wax and then there will be a space. The reason we don't want that bar to touch the lower teeth is we don't want it to put pressure on the lower teeth, which could potentially move them. So here I have on the inferior border, I'll do that on this side too. And again, we just kind of mold that on there. I try to avoid taking it all the way down on the holes so that I have that for retention of the GC reline. So now here I have added the wax all along the inferior border and put it on the anterior of the lingual bar so that when we put this in with the material in place, go ahead and close down, or we would have our bite gauge and open and close down. With that in place now and open, once it sets, we would just simply take that wax off, and then we would have a space between the mandibular tori or the teeth and the tray itself. So very easy to do, very easy to take that material off after the GC reline has set up, and that will keep you from having any kind of pressure on the mandibular tori or any kind of pressure on the lingual of the lower incisors. So a little trick there with some wax. So again, make sure that you always look, and if there are mandibular tori, use that little trick. If there are some lower teeth that you think you're going to touch with that lingual bar, just add a little bit of wax spacer there. After it's set, you simply remove the wax and it's a piece of cake.